Have you ever been sitting quietly, maybe watching television in the evening, when suddenly your feet start to tingle? At first it feels harmless. A little pins and needles. Maybe you think, I must have been sitting too long. You shift your position. You shake your legs. But then it happens again. And again. Or perhaps it's something more unsettling. You wake up at night with a burning sensation in your toes. You step out of bed and feel like you're walking on cotton. Or worse, like you can't quite feel the floor beneath you at all. Some of my patients describe it as ants crawling under their skin. Others say it feels like an electric current shooting down their legs. And here's what worries me most. Many seniors ignore it. They assume it's just old age, or poor circulation, or something minor that will go away on its own. But as a surgeon who has treated thousands of patients over the years, I can tell you something very important. Numbness and tingling in your legs and feet is not a random symptom. It is a message. Your body is trying to tell you something. Sometimes that message is mild and easily corrected. But sometimes, it's the first quiet warning sign of something much more serious. In today's video, I'm going to explain what that tingling really means. We'll talk about the most common causes in adults over 55. We'll uncover which symptoms you should never ignore. I'll share the hidden connection between your nerves, your spine, your blood sugar, and even your vitamin levels. And before we finish, I'll give you simple, practical steps you can start today to protect your nerves and possibly reverse early damage. Because here's the truth most people don't hear: nerves can heal, but only if you act early. Let me tell you about Robert. Robert was 68, active, proud of the fact that he still mowed his own lawn. He came to see me because his balance wasn't what it used to be. He said, "Doc, I just feel unsteady." When I asked if he had numbness in his feet, he paused. Well, maybe a little, but that's normal at my age, right? It wasn't normal. Robert had early nerve damage caused by years of slightly elevated blood sugar that had never quite crossed into diabetes territory. It had been labeled borderline, harmless. Nothing urgent, but his nerves were slowly suffering. The scary part? He didn't feel pain. He felt less sensation, and that can be more dangerous. When your feet are numb, you don't notice small injuries. You don't sense temperature changes. You lose balance because your brain depends on signals from your feet to know where your body is in space. Numbness is not just discomfort, it increases fall risk. It raises the chance of hidden wounds. It can even signal spinal compression or circulation problems that need attention. Now I want you to think carefully. Do you ever feel a burning sensation in your toes at night? Sharp stabbing pains that come and go? A feeling like you're wearing invisible socks? Cold feet that aren't actually cold to the touch? Weakness when climbing stairs? If even one of these sounds familiar, stay with me. Because what you're about to learn could protect your mobility, your independence, and your confidence for years to come. In the next section, I'm going to explain exactly what causes this numbness and tingling in simple terms. We'll separate myths from facts. We'll talk about nerves, circulation, the spine, and common medical conditions that quietly damage sensation over time. And I'll tell you which signs mean you should see a doctor immediately. Don't brush this off. Your legs and feet are your foundation. Once that foundation weakens, everything becomes harder: walking, driving, even standing in the kitchen to cook. But there is good news. Understanding the cause is the first step toward control. Let's talk about what is really happening inside your body when you feel that numbness or tingling. Imagine your nerves as tiny electrical wires. They start in your brain, travel down your spinal cord, and branch out into your legs and feet. These nerves carry messages back and forth every second of the day. When you step on the floor, they tell your brain, "This is hard." When something is hot, they say, "Careful." When you lose balance, they instantly signal your muscles to correct you. Now picture what happens when those wires become irritated, compressed, or damaged. The message becomes distorted. Instead of a clear signal, you get static. That static feels like tingling, burning, buzzing, or numbness. One of the most common causes I see in seniors is peripheral neuropathy. That simply means damage to the small nerves outside the brain and spinal cord. And the number one reason for this in adults over 55? Blood sugar. You do not have to be on insulin. You do not even have to carry a formal diagnosis of diabetes. Years of slightly elevated blood sugar, what many doctors call prediabetes, can slowly injure the delicate lining of your nerves. It happens gradually. so gradually that you barely notice. Until you do. Here's something most people don't realize. Nerve damage often starts in the longest nerves first. And what are the longest nerves in your body? The ones that go all the way down to your toes. That's why symptoms usually begin in the feet. But blood sugar isn't the only culprit. Let's talk about your spine. As we age, the discs in our lower back naturally lose hydration and height. Conditions like spinal stenosis or herniated discs can compress the nerves that travel into your legs. When those nerves are squeezed, you may feel tingling, shooting pain, or weakness. Sometimes it gets worse when you stand or walk and improves when you sit down and lean forward. I've had patients who thought they had poor circulation, when in reality, the problem was in their lower back. And speaking of circulation, yes, reduced blood flow can also cause numbness. Peripheral artery disease limits oxygen-rich blood reaching the legs. But here's the difference. Circulation problems often cause cramping pain when walking that improves with rest. The skin may look pale or shiny. The feet may feel cold. Nerve damage, on the other hand, often causes burning, electric sensations, especially at night. It's important to understand the distinction. There are also vitamin deficiencies, especially vitamin B12, that quietly damage nerves. I've seen seniors who felt unsteady for months before discovering their B12 levels were low. After correcting it, their symptoms improved significantly. Certain medications can also contribute. Some cholesterol-lowering drugs, chemotherapy agents, and even long-term alcohol use may irritate nerves over time. And then there's something I want you to pay very close attention to. Sudden numbness on one side of the body, especially if it comes with facial drooping, slurred speech, or weakness in an arm. That is not a wait-and-see situation. That can signal a stroke. That requires immediate emergency care. But most cases I see are not sudden emergencies. They are slow, progressive warnings. Here's a myth I want to gently correct. People often say, it's just bad circulation. They rub their legs. They buy compression socks. And sometimes those things help. But if the root cause is nerve damage, ignoring it allows the problem to worsen quietly. Another myth, nothing can be done. That is simply not true. Early nerve irritation can often be stabilized. Sometimes it can improve, but only if we identify the cause. I remember a woman named Linda, 72 years old. She described her feet as wrapped in plastic. She thought it was aging. We ran simple blood tests. Her B12 was severely low. After treatment and dietary changes, the sensation slowly returned. Not overnight, but gradually. The body has an incredible capacity to heal when given the right support. So now you might be wondering, how do you know which cause applies to you? And more importantly, what can you actually do starting today to protect your nerves and reduce that uncomfortable tingling? In the next section, I'm going to walk you through practical, realistic steps, simple habits, smart dietary changes, gentle exercises, and common mistakes I see seniors make that actually worsen nerve symptoms without realizing it. Because this is the part where knowledge turns into action. Now let's talk about what you can actually do. Because understanding the cause is important. But taking action is what protects your independence. The first and most powerful step is this. Stabilize your blood sugar, even if you've never been diagnosed with diabetes. I tell my patients this all the time. You don't wait for a house to be on fire before installing smoke detectors. If your fasting glucose is creeping up, if your A1C is in that borderline range, your nerves may already be under stress. Simple changes make a difference. Reduce refined carbohydrates, white bread, pastries, sugary drinks. Balance every meal with protein and healthy fats to slow glucose spikes. Walk for 10 to 15 minutes after meals. That short walk alone can significantly lower post-meal blood sugar. And here's a retention point I want you to remember. It's not just about what you eat. It's about how steady your blood sugar stays throughout the day. Next, nourish your nerves. Vitamin B12 is critical, so are B6 and folate. Magnesium also supports nerve and muscle function. Before starting supplements, talk to your healthcare provider and request blood work. Guessing is not the same as knowing. If you are over 60, absorption of B12 naturally decreases. Even people who eat meat regularly can become deficient. That simple lab test can change everything. Now let's talk about movement. When your feet tingle, the instinct is often to move less. I don't trust my balance, patients tell me. But gentle, consistent movement improves both circulation and nerve health. Walking, swimming, stationary cycling, these keep blood flowing to the small vessels that feed your nerves. Balance exercises are equally important. Standing on one foot while holding a counter. Heel-to-toe walking across a hallway. These retrain the communication between your brain and your feet. Because here's something fascinating, your nervous system adapts. It can strengthen alternative pathways when stimulated correctly. Now let me share a mistake I see too often. People ignore foot care. If you have numbness, inspect your feet daily. Look for cuts, blisters, redness. Wear properly fitted shoes with good support. Avoid walking barefoot, even at home. When sensation decreases, small injuries can become big problems before you even feel them. Another overlooked factor is posture and spinal health. If your numbness worsens when standing or walking and improves when bending forward, your lower back may be involved. In that case, targeted physical therapy can relieve pressure on spinal nerves. Strengthening your core muscles reduces stress on the lumbar spine. And please hear me on this, do not self-diagnose severe symptoms. If you notice rapid worsening weakness, loss of bladder or bowel control, or sudden severe back pain with numbness, that requires urgent medical evaluation. Now let's address nighttime burning, one of the most common complaints. Elevating your legs slightly can improve circulation. Avoid heavy blankets pressing on sensitive toes. Keep blood sugar stable before bedtime. Some patients benefit from gentle foot massage or warm, not hot water soaks to stimulate circulation. Sleep matters more than you think. Chronic poor sleep increases inflammation, and inflammation aggravates nerve irritation. Here's a powerful habit I encourage. Daily nerve-friendly routine. Move your body, eat steady meals, hydrate well, check your feet, stretch your calves and hamstrings. Maintain healthy weight, limit alcohol, which directly irritates nerves. None of these steps are dramatic, but together, they create a protective environment for your nervous system. And I want to give you hope here. Early nerve irritation is not a life sentence. I have seen improvement in patients who committed to steady blood sugar control, weight management, and nutrient correction. It takes patience. Nerves heal slowly millimeters per day, but they can recover. Before we move to the final part, ask yourself something honestly. Have you been ignoring your body's signals? Because tingling is not just a symptom, it's feedback. And when you respond early, you protect your future mobility. In the final section, I want to talk about something deeper, your independence, your confidence, and why taking this seriously today can mean walking strong 5 or 10 years from now. I want you to picture something with me. 5 years from now, you wake up in the morning. You swing your legs over the side of the bed. Your feet touch the floor, steady, confident. You walk to the kitchen without hesitation. You go outside, feel the ground beneath you, and trust your balance. That feeling, that quiet confidence in your own body, is something we don't fully appreciate until it begins to slip. Numbness and tingling in your legs and feet may seem small at first, annoying, inconvenient, easy to dismiss. But as we've talked about today, it is often your body whispering before it starts to shout. We've learned that those strange sensations are not random. They are signals traveling along delicate nerve pathways that can be affected by blood sugar, vitamin deficiencies, spinal compression, circulation problems, medications, and lifestyle habits. We've talked about how the longest nerves in your body, the ones reaching your toes, are usually the first to show distress. That's why symptoms often begin in the feet. We've separated myths from truth. It's not always just bad circulation, it's not always just aging, and it is absolutely not something you are powerless over. You now understand that early nerve irritation can be stabilized, sometimes even improved, but timing matters. You know the warning signs that require immediate care: sudden one-sided numbness, weakness, speech changes, and you know the quieter gradual signs that deserve thoughtful evaluation rather than neglect. Most importantly, you've learned that small, consistent actions can protect your nerves. Steady blood sugar, balanced nutrition, vitamin awareness, gentle daily movement, foot care, spinal health, restful sleep, nothing extreme, nothing unrealistic, just steady commitment. And here's something I want to say from the heart. Growing older does not mean surrendering your independence. It does not mean accepting every symptom as normal. Your body deserves attention. It deserves respect. And you deserve to feel secure standing on your own 2 feet. I've spent decades in operating rooms and clinics, and if there is one lesson I carry with me, it is this: prevention is quieter than surgery, but far more powerful. When you listen early, you avoid bigger battles later. If this video helped you understand your symptoms a little more clearly, if it reassured you, or even gently pushed you to take action, then that means everything to me. Take a moment today to check in with your body. Schedule that appointment if you've been postponing it. Go for that short walk after dinner. Look at your feet before bed. Small steps truly add up. And if you found this information valuable, I invite you to support this channel. Like the video so more seniors can see it. Subscribe so you don't miss future conversations about protecting your health. And share in the comments. Have you experienced numbness or tingling? What did you discover was the cause? Your story might help someone else feel less alone. Remember, your legs and feet are your foundation. Protect them. And you protect your freedom. I'll see you in the next video. Stay steady, stay informed, and take gentle care of yourself.